The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Welcome once again to this week's episode. This is your co-host, Dr. Herb, and with me is your co-host, Dr. George Rogu, and our guest, Pedro Sanchez de Lozada. He is the CEO of Canid and will be talking to us about serial entrepreneurship and the intersection of vaccines, technology, and the small pediatric office. Hi, George.
Hey, Herb. How you doing?
Great. Today, we have the pleasure of hosting Pedro Sanchez de Lozada, leveraging technology to make the business of vaccines work for you. How are you, Pedro?
I'm doing great. How are you, Dr. Bravo? Dr. Rogo, good to see you.
Great. It's an honor to have you here in the lounge. Yeah. I understand you're from Chile, Santiago, Chile.
That's right. Yeah, I've been here in the U.S. for 14 years, but I grew up in Chile, and I've just come here to make my career.
Wow. Did the team make the World Cup or?
Oof. Oof. Pain already. We started. It was a bloody fight. They should have made it. They've been. I'm very mad at our team right now. So. Oh, brutal.
Oh, well, I was going to ask you which one's better, the pisco chileno or the pisco peruano?
Oh, of course, the pisco chileno. Come on. What kind of question is that? It's interesting because, I'm going to get some hate from people from Chile, but pisco comes originally from Peru, but in Chile, we drink it all the time. So it's like a much more of a staple of the culture. And so there's always that rivalry of who's the real, pisco drinker.
So we have one listener in Lima, Peru, who's a pediatrician.
Okay.
I'm sure she's going to have something to say about that.
I'm sure she I'm sure she will.
George, the Argentinians and the Peruvians and the Chileans are very what should I say, tribalistic. So they argue over these things.
I know.
And there's big rivalries here.
I guess they talk about this in the lounge, but let's get on to business.
Well, Pisca's a big business, man.
Yeah.
It's a great drink. All right. So tell me, so we know you came to America to make a living, and you live in New York.
Yep, that's right.
Okay. What motivates you in general? The business world, making money, saving the world?
I think that those two things, get a bad rep when you don't, when you think about one or the other, right? Either you make money or you're saving the world, right? And I think when I start to think about it, I think about how do you leverage the ability for small businesses to exist, and something that we'll talk about a little bit, but in order to actually improve the conditions of the world, right? And we're going to talk a little bit about this, but I work in vaccines, I work with small businesses, right? And yeah, do I want to make money? Do I want to grow as a professional? Do I want to continue to do the things that I do? Yeah, absolutely. But ultimately, if it doesn't have a mission that is worth fighting for, then I'm not that interested. So that's why I'm doing what I'm doing today.
We got to go with no margin, no mission, right?
Yeah, exactly.
That's a concept that a lot of physicians they get stuck in between those two worlds.
Yeah, and it's one of the other reasons why it's exciting to be in medicine as well, and pediatrics. It's like there's a very clear alignment between making this a business and also helping people live healthier lives, and that's something that I've really enjoyed, and I'm excited to be a part of that.
Cool. So you have an entrepreneurial streak in you, right?
Mm-hmm.
And because this is an episode on innovation, we're always interested in learning lessons so that pediatricians or other people that are in the industry can become entrepreneurs and lead innovation.
Yep.
So you were at Merlin, is that
Yep.
right? What does Merlin do?
So Merlin was actually a jobs platform. Basically, well, so there's kind of three companies I would say that have been kind of the places where I've seen these companies grow and scale significantly, and that's Udemy, Rinse, and Merlin. All of them together have a kind of common theme. They're all in different industries. They all do completely different things. But the common theme that they have is they are small business enablement companies, which means that if you have a small business in that industry, Udemy was in online education, Rinse was in dry cleaning, Merlin was in restaurants and retail stores. These would provide you with tools that would effectively allow you to kind of punch above your weight. Give you access to efficiencies and economies of scale that you wouldn't otherwise be able to get access to. And so Merlin, for example, was all about high velocity recruitment in the restaurant and retail store space. So if you're a restaurant, typically you have people who leave the job, there's high turnover, waiters are hard to sometimes they leave and you have to be hiring all the time. And so a big thing that distracts you from being able to run your business is hiring people, right? And we actually, by the way, we see that in pediatrics as well, right? It's like one of the core things that tends to be a problem for pediatric practices when people are coming and going all the time, right? So in this platform, we basically built a way for restaurants and retail stores to hire people faster. And instead of taking, a couple months to hire someone, take a couple days and even a couple hours to get to a close on the right hire. So that's, yeah.
And so walk me through the stages. When you got there, was it a gritty startup or was it already
basically
funded? Okay.
So at Merlin and all of these companies, I've actually joined very early on, oftentimes before we've made a cent of revenue, and basically had like a core idea of what we wanted to do, and grown those companies to become nationwide brands, right? So Udemy right now, I joined pre-revenue. They went public last year. So in the last 10 years, I joined them in 2011. In the last 10 years, they've become an international gargantuan thing.
So they're
Rinse,
public now.
Rinse
What did Udemy do?
Udemy is an online education platform.
Okay.
So basically, if you think about it, right, if you go online, you can probably find courses of Yale professors and Harvard professors, MIT professors that do online courses sometimes. Effectively, what Udemy did was give anybody the tool to build an online course, the tools to build an online course.
Okay.
And so if I had something that I wanted to teach to the world, whether it's, pediatric innovation or, coding or whatever it is, then I could go on Udemy and build my platform and build my online course and monetize it, right? And many of the professors there started their businesses with Udemy and made millions of dollars actually running their business online.
Wow. And so is it Coursera? That's the other one.
Coursera.
Coursera?
Yeah, Coursera is kind of the academic version. So they are the ones who work more with professors. And Udemy was more working with independents.
And you got a certificate? Is it possible to get a certificate like
you can? Yeah, you can. And I've certainly seen plenty of resumes. It's funny because we now hire at Canada, my company, we now hire engineers who are abroad, and Spanish language courses in software development. Pretty common for software developers to take courses on Udemy. And so they put Udemy on their resume as like, I took this course, here's my certificate, here's all these other things. And it's awesome to see that 10 years later, and like all of a sudden people who I've never met are coming to us and saying, hey, we learned this stuff on the platform that that you were building.
That's really cool. And so was that the what did and so that's one that went public. Are the other two public yet, or?
So Merlin was acquired by a company that's actually in healthcare infrastructure today. They're called Commure. So they were acquired at the beginning of the pandemic. So they're not public. It's possible that that company becomes public. And
Okay.
then Rinse is private, although they are expanding a lot and they're moving nationwide. They actually just got to New York and they're doing a lot of good, cool things.
Wow. And
What
so
I'm
you
seeing,
went.
what I'm seeing with this is same kind of theory is happening in the medical world, where big VC companies are pumping money into organizations in the hopes that they'll do something.
Yes.
Why would a VC company pump money into a medical practice or into a company when they don't even have a product?
So it depends on the type of idea, right? When we think about what a venture capitalist wants, there's a high risk of everything that they invest in, right? And they're going to invest on something that probably is not going to work. In fact, 95% of the time, it's just going to fail and not going to do anything. But the 5% of the time that it works, it's going to become a company like Udemy that becomes public. So if I'm putting $1 million, right, into a company early on, and they have an idea, basically, you know, if you think about Udemy's core, it's like, what are we going to do? We're going to rebuild how education is engaged with, so how people learn all throughout the world, right? A massive undertaking. And you know, they are now you know, went public for 4 billion, right? So like that $1 million got multiplied so much that it didn't matter. And so that one investment that didn't fail actually pays back all the rest. So you're basically taking a lot of small bets here and there to get that really, really big, juicy payoff at the end. So basically, that's the way that you need to think about this, right? It's like, how are you going to get that payback that is so worthwhile that nothing else is going to matter, right? And if you are approaching a VC, that's what they're going to ask you. How does this become a $1 billion business or more?
But in healthcare, we're taking bets on people's lives and people's professions.
Yeah.
Yeah, you know, I have a friend of mine who always says this. I agree with that. But there's also a lot of things that are broken in healthcare too,
Yes.
which means that not taking bets to fix it is also kind of being stagnant and saying, okay, we're not going to improve things. Therefore, we're still going to affect people's lives and we're still going to hurt people. And so ultimately, which one's better? It's hard to say.
Yeah.
Yeah.
So this is not a new concept. If you're old like me, you might have read Peter Lynch, who was the head fund manager for Magellan, which is one of the most successful and largest investment funds for Fidelity. And his theory was, you don't need to be right on every stock. You just need a 10 bagger. And a 10 bagger is the same thing. If you invest in 10 stocks, $10,000 each, and you lose everything on 9 of them, but one doubles 10 times, you got $1 million. So your profit is $900,000. And that's the VC theory.
Yep.
That's not the medical theory. I'm not happy when 9 patients die and 1 survives. You know, so it's such a foreign mind shift for a doctor to think that way. Anyhow, I'm really interested why you would focus on the pediatric independent practice, and particularly the small independent practice, on this project.
Well, I've always had this affinity to small businesses, right? As I've said, and I think that's something that I care a lot deeply about. It's also part of the family. My mom is a pediatric gynecologist, and my uncle owns his own private practice. So I kind of have been raised in this world to some extent. Now, you know, when I think about the independent pediatric world, I also think about it as an economist. So I actually am an economist by training. I come from that world And one of the things that they teach you in economics is that if you have a small amount of people providing a service, and the people who are buying that service are, not able to say no, then that price is going to go up, right? And I think that's one of the things that we're seeing in the healthcare world today, where basically these big health systems are gobbling up all the little ones. And if you are a patient, you can't say no. You can't just say, I don't want healthcare, right? You can't go anywhere else. And so you end up paying whatever it is, right? And so to me, and what we see, by the way, is actually that being effective, which is prices going up, quality not going up, doctor payments not going up, and prices actually just ballooning across the board. So basically, I think of this as enabling the independent providers so that we can have more providers who can provide benefits for the doctors, provide benefits for the patients, make the cost go down overall, and give a better competitive advantage to the small business in the space, right? And I think today, these bigger businesses, these the ones that are gobbling up, just basically have all the competitive advantage, and I want to change that.
And so the other thing you said it very eloquently. But the other thing that goes down when you have that kind of market power is service.
Yeah.
So when your local hospital owns 85% of the beds, they don't really have to worry about quality or service because you got no other choice. You're sick, you're going to have to use their beds.
And there's a lot of studies around that, right? It's actually studies around where consolidated markets. I was actually reading a study a month ago or so that's compared the San Francisco market, which is a highly consolidated one, with the Los Angeles market, which is less consolidated, and how the benchmarks of quality change from market to market, even in the same state. Yeah. And how San Francisco is much more expensive, even comparing cost of living. Obviously in San Francisco is more expensive, but even if you control for that, you're still having higher prices in San Francisco by 30-40%, whereas in LA you can get much better quality and better care, even without having any of those consolidation factors, right? And prices being higher.
And then, so I understand your passion for small business.
Mm-hmm.
Why did you want to focus on vaccines?
Yeah, so when I think about vaccines, I think we've maybe we haven't necessarily forgotten, but I think that we are not giving the credit where it's due to vaccines, right? Where vaccines at a high level are incredibly life-saving interventions, probably the most important healthcare intervention people could get, right?
Great statement, Pedro. It's life-saving.
Yeah.
Simple. It's not just a shot.
It's not just a shot. And it's, we actually saw it firsthand in the last 2 years where we were all stuck at home, wearing masks, all these other things. And all of a sudden vaccines come out and we can actually start to do more things. We can start to have going back to a normal life, being able to travel, being able to do all these things without restrictions. And that is something that has an ROI that's astronomical, right? Your return on investment is just crazy, even if you're only thinking about the dollars and cents. And so why did I work in vaccines? Because I look at the pediatric practice, which is, whose practice revolves around vaccines ultimately, right? Every appointment, most appointments will have a vaccine associated to it, and therefore, your schedule revolves around it. And I do think it's a shame that there's not that much money being made in vaccines. I think that financially, practices should be, very, very incentivized to give vaccines, and that there's also insurance companies and governments who are willing to pay for that. But it's all about kind of coordinating the right way and making the right arguments to make sure that people can improve their reimbursement amounts. And a lot of the times, I mean, some people do make money, but even then, I think there could be more. I think that the pediatrician should have a high incentive to actually help the kid, and they should be able to also take the time to just explain to the parent why this is important. And it's something that we see in pediatrics a lot, where it's really hard to take that time when you have 30 patients on your schedule and you're trying to get through as quickly as possible. So basically, I'm trying to rebalance a little bit the economics here, where the return on investment is more aligned with what it should be, or what the, what it should be based on how life-saving.
So if I'm hearing you correctly from your hat as an economist, a vaccination that prevents disease, it has a tremendous return on investment.
Yeah.
Not only for the individual, but society as a whole.
Yeah, it's actually, so just on healthcare costs alone, the return on investment is 10 to 1. Every vaccine that you give, for every dollar that you spend, you're getting $10 worth on them not getting hospitalized, right? And then it's actually 100 times to 1 based on societal improvements, that person's productivity, them being able to actually, add to the GDP. We can go like pretty abstract here, right? But all in, it's a crazy amount of money that we're saving whenever we give a vaccine.
Well, I'll give you an example of how that illness costs a lot of money. When I was an intern in 1993, Jersey City had an outbreak of measles. Okay. We were working in the emergency room, kids coming in with 105, 106 fever, hyper, dehydrated, sick. They would get admitted, measles. One day I went to work, I passed out, full-blown rash, 105 fever, admitted to the hospital for 2 weeks. The hospital where I worked at. Nobody knew what I had. So one of the residents came to visit me and says, "Oh, you look like all those kids that were admitted with measles." Lo and behold, they're looking for weird stuff, Ebola, all these weird diseases that are not going to happen. Nobody took the time to say, what does this guy do? And it had to cost a lot of money. Now, why did I get the measles? Because I was of that generation. You could have had one, you should have had two. It was paper charting, so change doctors, it just got lost.
Yeah.
And somehow I made it into kindergarten without that second booster, because you could have had one booster, maybe not two. And the saddest part of the whole story was, you get all these titers to go to work in healthcare. I had titers done to go to work. Guess who did not have titers to measles? But results came in very quickly. Nobody looked. It was 4th of July weekend. No titers for Dr. Rogu. I mean, what a stupid story that is.
Yeah, but it shows
how much money did that cost? It cost a lot.
Yeah, and the personal suffering that you had. Being 2 weeks in a hospital is not any fun. And so the other reason you are trying to align the payment model a little better than it is. Well, there's a lot of talk in healthcare about pay for performance or pay for value, but when it comes to preventing disease, it's empty talk. Because you're correct. If we know that the return of a vaccine is 100-fold, then you can't be paying pediatricians $10 to administer the vaccine.
Absolutely.
That's just ridiculous. That's, but the insurance companies, health plans talk a lot about pay for performance, paying for value. And when it comes to actually paying, they'll pay $100,000 for Gilead's drug that fixes hepatitis C, but they want to pay $10 for giving a vaccine.
The reason this is the problem. The old vaccines like the polio and the DTP, the really, really old stuff, the HIB, they don't cost that much. All right. So they don't cost that much. And then you mark it up $10 and then you get the administration. It's not a bad thing. And you do an office visit. Okay. You got 3 of them. It adds up to the visit. But when you throw in the HPV, which costs, I think it's the Prevnar,
$239, I think.
$239, and the Prevnar, which is a couple of $100, and all these other more expensive new vaccines, and they blame it on R&D, research and development, and they pay $10. Think about it, with the Coca-Cola bottle of the soda in the corner of the store. They teach you that in your school, right? When one falls down and breaks, it doesn't matter because it didn't cost that much. It cost 2 cents to make, and you still have all the others. But what if you drop a vial of HPV vaccine? $10 to make, and it costs you money.
Huge loss. But my point is that if you really believe in pay for performance or paying for value, you would have to pay for these vaccines, even though they don't cost a lot to manufacture, a good amount of money, because they are saving so much money. So the reason that Gilead can put their drug for 100,000 and it's a miracle cure, is because if you have hepatitis C, you're headed to cirrhosis, if not liver cancer, to a liver transplant, which costs $2 million, just a medical procedure. So to the insurance company and society, it's well worth investing $90,000 to prevent a person from dying, not being able to contribute because they can't work, and on top of that, get a $2 million liver transplant if they can find it. But we don't look at, or industry does not look at vaccines in the same way. They're just a cheap utility that needs to be given, and we're done.
You need a shot to get to school.
That's it.
Okay.
You know, here's one of the things that I find really interesting about this is that, so there's, you know, when you're giving a vaccine when someone's like 2 months old or whatever, right? Under 2 years old, call it. They're not going to get sick when they're 35 or 40 or 50, right? And the time horizon, even though everyone knows the value of this, the time horizon is so high that you know, insurance companies who are effectively paying for these vaccines aren't actually incentivized, because by the time they're 35, they would have probably changed like 4 times from insurance carrier, right? And so the premiums that I'm going to save, even if I'm thinking that long term, which is hard to do, right? You know, these public companies, they want to get profits quarter over quarter, right? They're not thinking about that 40-year horizon. But even if they were, they still wouldn't have you, and they wouldn't save money on you. Right. Now, I will say there's more and more things happening here where people are realizing that, and especially with something like this latest pandemic, where we started to see, you know, real direct ROI to vaccines. People are opening up a little bit more here, and especially with vaccines. I think other forms of preventative care are still going to struggle, unfortunately. But when it comes to vaccines, the data is so clear that you know, people are starting to get really organized around making sure that we can do that. And I think it's about enabling pediatricians to also capitalize on that when there's enough scale and enough organization in the community to actually make the case for vaccines with the right insurance companies and the right stakeholders at those insurance companies and even governmental entities, right? So I think there's more juice to be squeezed. It's just a matter of like organizing and getting the right amount of scale where you can actually do that.
So tell me what CANID is and what it does.
So at a high level, actually, maybe taking a little bit of a step back from vaccines, we have a personal motto that we care about a lot at CANID, which is letting the pediatrician worry about the kids and be there with the kids while we handle the administrative part of managing the pediatric side of the business, right? And so we actually take that motto and apply it to the vaccine world. And that's how we built our first product, right? And when I say first product, right, the plan is to continue to build out more tools that can help automate other things as we scale. Right now, we're very focused on vaccines, but obviously there's more to be done in the pediatrics world. When I think about vaccines, though, we actually take that to heart in that our goal is to put your vaccine program on autopilot. And there's 3 parts of that. Part number 1 is making sure you are financially secure. You're making money. It's not costing you money. You can have visibility on how much money you're making exactly, and you're not getting underpaid or shafted by some insurance company, whatever it might be. So all of those things are kind of part of the financial equation here that we help you track and manage and make sure that you don't have to worry about it because you know that it's in good hands. There's the automation portion, which is effectively the making sure that all the things that should be automated are things such as ordering new vaccines and making sure you're always stocked up, as well as, you know, submitting those bills to the right place at the right time with the right rule set, as well as, you know, tracking things like, oh, is this kid coming from a VF, you know, needs a VFC vaccine? Are they about to get a private vaccine? Should we have a, you know, have a,
Right.
should we double check what we're
So
doing?
I'm going to
right?
interrupt you a little bit. So
Yep, go ahead.
On the one hand, you're an inventory management system. And does this inventory management system communicate with the EHR?
So when it comes to inventory itself, we actually track that separately. So in your
Okay.
EMR, you're not going to have your inventory anymore. What we do is, as you give those vaccines, we will update your EMR to make sure that the records are correct. So that I'm basically separating, like, the inventory itself stays in our platform. The records of the
records
vaccines
goes
being
on
given
the EHR.
are going to the EHR. Yep.
And if they go into the EHR, then they're going to the state local databases. So in
Right.
Virginia, if you vaccinate today, you're required to participate with the
We
state.
actually have a bidirectional connection ourselves with
Okay.
the EHR. So we effectively have the records of the kids that we've given vaccines from the immunization registry directly. So effectively, we're doing that same connection that your EMR has through our platform.
And then when the medical assistant or LPN is going to do this, does she have to type in the lot number, or do you have a bar to scan it with?
So yeah, so the key workflow difference here is that it's all based on scanning. And every time that you give a vaccine, you have to scan the little 2D barcode. This enables us to be a lot smarter and have a lot less human error in the process. And so that actually allows us to flow all the information the right way. So what you need to do in our platform is effectively scan the vaccine into a patient's profile, and then you're done. Everything else kind of flows into the system.
And do you have any idea how much that saves in human capital time?
So we typically, what we do when we work with, is you're effectively saying, we're going to remove the inventory side. We're going to remove a lot of the billing side. Those are the big kind of, hey, these are off the table now. In terms of the actual workflow on the day-to-day, we expect it to be about 30 seconds to use our platform. So it really depends on how often you use this process. If you effectively, we've seen, for example, with Dr. Rogu here, when it comes to the COVID vaccine, we were able to push a higher velocity of patients per hour by making sure that we would do that. And I think we were able to improve it by 50%. So because we were spending a lot less time entering that stuff into the EMR, and that was able to, and we were able to actually move through the administrative part a lot faster as well.
So not only employee wages are expensive, but nobody likes repetitive tasks.
Of course.
So when you're having to write down 10 times the lot number of vaccine in a kid's chart, that's just not engaging to the employee. And I need that employee to be happy and engaged so that they can help me with the patient, so that you win on both ends, right? That's a great design. So tell me, why should my practice, and what practice should call you and say, hey, let's have a talk and get your product in my practice? What's your target audience, and why?
You know, we work with practices of all sorts, but we do tend to have an affinity towards smaller independent practices. And the reason for that is because we think we can add a lot more value there. And we're still basically like building up the tools to be able to iterate at high scale. So when we think about this is, if you're a practice, it's an independent practice that wants to stop thinking about their vaccine program as much and put it on autopilot, make more money off of it, we would love to work with you. We are also exploring opportunities with bigger organizations who could be also great at once we get to higher volume. That's a little bit of a longer term play for us right now, very focused on the smaller independent practices.
So I guess this becomes like a vaccine for children program, but for commercial vaccines, where you get the vaccine, you give the shot.
Yeah.
They don't have to deal with anything.
So it's an important thing as well, because financially that there's a part of that that's true. But on the side of the operations, right, a vaccines for children's program actually is a pain to deal with. We all know that, right? And so we're actually also helping you deal with your vaccines for children's program, because one of the things that I think is the problem in a lot of these practices is they have to be thinking, okay, if vaccines for children, then we have to do this, and if it's private, we have to do that, and there's all sorts of different rule sets for each, and that can be complicated. People make mistakes with that. And so effectively, we want to make it so that it's a single flow that everything goes through, so that you don't have to worry about those things, right? And then we can help you, whether it's private or public, you're still doing the exact same thing, you're taking the exact same steps, and so it's less complicated and it's less prone to error. If you think about it as a vaccines for children's program, yes, but we also don't want to add a whole bunch of additional complications. We want to make sure that you're taking that off your chest instead, and it becomes more simple, including the management that you have to do of the VFC program as a whole.
That's great. I mean, that piece of scanning and automation is just so many winners in that. Yeah. Now, are you able to negotiate prices with the payers?
So that's one of the things that I think is really interesting about our platform, because one of the things that I didn't have an opportunity to mention is that our last kind of pillar of action is around public health improvement, which is effectively like, okay, if a kid is running behind on their vaccines, or even if they're about to get their vaccines, can we preemptively answer questions for the parents, give them the right catch-up schedule, make sure that they come back in a way that it's not like, hey, we're scrambling to hit that 2-year HEDIS measure, and so therefore we're going to call, everyone that's 18 months old and is running behind, right? And let's make it proactive. Let's make sure that we start as soon as they skip that first appointment. Let's put up a catch-up schedule that makes sense. Maybe there's a piece of this that is culturally relevant, where it comes to like, okay, this is a Spanish-speaking patient, therefore we should engage them in their own language in a way that they can understand, and automate all of that process so that it doesn't become a burden on the side of the pediatrician.
So would you use AI? Will you be using AI to drive that through, or?
Yeah, I mean, more than AI, it's just analyzing the data, right?
Okay.
We are connected with the immunization registries, so we're able to actually see if a kid is behind based on the immunization registry records. And that would enable us to effectively catch people who are not.
How do you visualize this data? Let's get really into the nitty-gritty details. Do you use IBM Power BI, or do you use what's the other one that's really Tableau?
So we right now have a system called Metabase, which is similar to Tableau. But we are actually developing our own. To some extent, it's not as easy to see it to see it through the existing tools. So we want to build it into the platforms. That's kind of a new iteration of this that's coming up. But it's also important to note that our goal isn't to just visualize it for the pediatrician, it's to act on it.
It's to execute.
Yeah, to execute,
Yeah,
right? Because ultimately,
just
if
I'm
we
getting
want
in,
to,
I'm getting in the weeds, and I'm just
yeah,
interested. So there's a language called, is it R? A
yeah, R
programming
is
language?
for statistic analysis. Yeah.
Yes. So is that the kind of language you're building your dashboard on to
Not
become
exactly.
actionable?
The databases are built on SQL,
Okay.
and then the front end that powers this whole thing is built on Python.
Python. Okay. And then this is probably not this is not a subject for the podcast because we're getting too deep into it, but the design and the execution. So I say, this is my saying, big data is like a lump of coals.
Mhm.
You can barbecue with it and make yourself sick. That's about all you can get out of big data. Now, actionable data is actually the nuggets of gold you'll find when you're mining.
Yeah.
And when you get actionable data and you automate execution, now you have a perfect purity diamond.
Now, Pedro.
And that's where you're trying to get to,
Yeah,
Pedro, right?
exactly.
That's
Great.
phenomenal.
So, but an EHR can give you all this stuff. It can run a report, tell you how many people you're missing. What's the difference?
So
with the dashboard,
the difference is in the execution, I think, because you're right, actually. Like EMRs have these tools. Sometimes they can give you really good reports on how well you're meeting your HEDIS measures and whatnot. But the big difference between an EMR, what an EMR does and what we do is that we will actually take that information and do the outreach, right? And work with your patients to make sure that they come back at the right time. And that is, it's different because if you go to, the way that I like to describe it is, if your goal is to build a house, I could give you some hammers, some tools, some wood, some nails, or I could just give you the house. And in this case, we're giving you the house, right? An EMR is giving you hammers and nails and tools. That still takes a bunch of time from your team to actually execute on. And oftentimes there's no time for that, realistically, right? And so, people end up scrambling and there's all sorts of things. So the automation of making sure that we actually execute on this in a relevant way is a really key part to doing
the vaccine dashboards. I'm big on dashboards. Okay.
Yeah.
I could run reports in my EHR. The truth of the matter is, I don't want to go in, copy the SQL code, put it in, give a date range, run a report, walk away, drink coffee, come back, get the spreadsheet, and then look at it. Okay. I don't have the time to do pivot tables and make graphs and stuff. I need an online dashboard in the cloud where I punch the button and it says, okay, this insurance has this quality measure, and you have all these people that are missing the measure. And if you don't do it, you have the potential to lose X amount of money.
That's right.
Yep.
So you're doing good quality, you'll make money.
You're missing a very important factor, which is implementation. There's a whole science behind this. But what I've seen in the worst tragedy stories is, you Pedro, you might not remember Telebox, but Telebox was an automated appointment and reminder service very early on. So at one practice I consulted on, they had Telebox for 10 years, and a staff member had to run a query every day that downloaded their schedule and then uploaded to Telebox, so that they would call the patients at night, reminding them to come into the office the next day, right? High-performing ophthalmology practice. We switched their revenue cycle management, and now this function is completely independent of human touch. It's the appointment gets scheduled, then I wrote the rules into the software, and 2 days before that, they get a text message. If they don't respond to the text message, they get a follow-up email. If they don't respond to the email, then the night before, the afternoon before, they get a phone call. The calls go between 10 a.m. and noon, and 4 and 6 in the afternoon, because that's
Yeah.
when people actually answer the phone.
Yeah.
And the staff went nuts. You know why they went nuts? Because all of a sudden the phone was ringing. People were saying, I got a call from your office,
Yeah.
and I let it go to voicemail because I didn't recognize the number. Why were you calling me? Because we're going to see you tomorrow.
Right.
Oh, and the business owner goes, something's wrong. My staff's complaining. They're getting a bunch of phone calls. I said, yeah, for the last 10 years, they haven't been downloading it. You've been paying for Telebox. They haven't been reminding the patients. God only knows how much money you've lost
Yeah.
Yep.
because these patients didn't remember to come in.
Well, that's a matter of efficiency. And back in the days,
So
of
what Pedro is
telephone-
saying is, I'm going to automate that process so that I have diamonds. So that, this is not as, what mood is Herb in? Did he have a good day? Does he want to go out for happy hour? Oh, he doesn't want to, he doesn't deal with somebody else saying, why are you calling me? I already know I'm behind. So that's genius. So what's a value proposition for the office? You have to obviously make money. If you can't
Yep.
negotiate on the prices on the contracts with the
Well,
insurance companies, you can add some
what
on the
what I
buying
can
side because
yeah.
you're buying so much. So
So
what's the
what
value
we
proposition for you?
can, so our goal is to actually negotiate with them, because what I was getting at here is that the thing that insurance companies are looking for is higher percentage vaccine rates. And so
Okay.
if we can actually show that over a course of time where we're using, our automation to actually get people back in the door at the right time, we can then go back to the insurance companies and the VFC program, public, whatever it is, and basically tell them, look, we're vaccinating at a higher rate here. Let's make sure that we actually get paid for that, right? And I do think that that's a little bit of maybe of a longer term strategy. We do need a little bit of scale to be able to do that. And so that's right now we're building that infrastructure to do it. We are, as you said, negotiating on the price side as well for the purchase price to make sure that we can make margins off of this. And that's really where we start to expand our margin base over time.
Right. And when you're ready for that, I have two people to introduce you to.
Great.
For that last piece of implementation. And that's part of one of the goals with IPI is to get really smart people into the room with pediatricians so the pediatricians can learn to innovate and be entrepreneurs.
Love it.
But the key here is design so that both the user, the pediatrician or the nurse, and the customer, are engaged by it and
Yep.
how you engage them. It's a whole new science.
Yeah.
So the value proposition is you will do you take the vaccine administration fee or
We do not. No, we basically, the way that our financial model works is we
Yes.
will buy the vaccines for you and we will capture the reimbursements from the insurance company. We do all your billing, we do all your management, and you get paid back the full amount of the administrative fee. So effectively, we're saying we're going to be suppliers for you of vaccine.
Okay.
And then we're going to manage the whole process to make sure that it's super seamless for you, so you don't have to worry about it at all. So
Okay.
you're a disruptor in the industry because that process already exists, but they do take the admin fee.
Yeah. And look, I think that's look, the way that I see it is I actually want to make this win-win for people, right? And I think when you start taking part of the service that pediatricians are providing, then we're actually kind of eating into the margins that are really, really important for a pediatrician to keep working, right? So we actually think about this as a scale game. We are making less maybe margins than other people doing this stuff on the unit basis, but we're actually working with bigger clinics that can be scalable. We're working with many more clinics, and so that enables us to make the money that we need to make to stay alive and keep the lights on, while not eating into a critical part of the pediatric margins, which is that vaccine administration fee.
Yeah. So I'm going to ask you to walk me a little bit. So I'm a pediatrician.
Yep.
When I started the last practice I started, I had to go to the bank and get an SBA loan. And you think that, raising money is a pain. Try to get an SBA loan when you don't have a business yet. Okay.
Yeah.
It's ridiculous, but well, we got it, and we launched. So how do you go about finding angel investors when you have very little to show?
You know,
A good slide deck.
I think you have to sell the vision, right? Because what are we going to do? If I think about what do I want to create? And this is just staying within the vaccine world. I
Yes.
want to change how vaccines are given in this country, right? Basically, like I want to affect every child that is born.
Yes.
And that's it. I want to save their lives, save them from hospitalizations, and change the attitude that people have towards vaccines as this kind of like nuisance that kind of hurts a little bit and sometimes makes me scared, to actually the life-saving device that it is, right? And
Right.
and that's where we're selling a vision of big opportunity effectively. And so that's really the key, right? How do you actually sell that vision in a way that makes sense? And then you're using your tech, I guess, or your deck, as Dr. Rogu said, to prove it. Both, what are you going to do? Why are you the right person to do it? And why are you able to how are you going to make it financially viable such that it becomes this kind of life-changing or a country-changing organization that you want it to become, right?
Okay.
That's what you need to prove. And
you put your shoes on as if you were an angel investor.
Yep.
So if I owned your company, I would say, one, there's 3.5 million newborns every year.
Right.
Even if I can get this platform that's, and I can get $10 from each, that's $30 million in revenue. If it was just, that's
only for one vaccine.
For one vaccine. And next year there's another 3.5 million newborns. So I get to do it over again, another $35 million in revenue.
Right.
So I have a recurrent stream of revenue.
Right.
Now, here's the other key point, because it's you. This is the third time you're doing this, if not the fourth. You have a clear mission of what you want to achieve, which is a good story to be told, right? So if I was telling you, I want to make sure kids stay healthy and save a lot of money in the healthcare system, when our GDP is now up to 20% of our GDP is being spent on healthcare, and this is a return on investment of 100 times. That's a nice sell pitch, right?
Absolutely. Look, if I'm pitching this to someone, I'm saying I'm going to save the health system $200 billion every single year, right? Because we were able to actually do this in a way that has such ridiculous return on investment that it's totally worth doing, and let's go do it, right? And that's the type of kind of pitch that you're looking for.
Okay. And then the people, you've got the experience. Yeah. Okay.
Exactly.
And then I would go, well, show me the design, because the design is going to be key. I want to see the design, and then finally, how are we working with the data? Because again, we can put tons and tons, billions of data in there. It's absolutely worthless unless we know what we're doing with the data, right?
Yeah.
And so, how much do you think we could fundraise from angel investors at the very start? It's just a concept. $1 million.
I mean, that's what we did. We raised $1 million last year, and that's before we had, really a product in market. So it's totally possible. It's not easy. I will say, like, there's a challenge to it, but certainly possible to do that. Especially right now with like markets downturn, I probably would say be a little bit more conservative, but that's reasonable.
Okay. And you didn't go through an incubator or an accelerator?
Nope.
Nope. And because you have the network already, because you've done this before.
Right.
Okay. And then at what point would a VC get involved? And for those of our listeners that are not familiar, that's a venture capitalist, and they tend to try to hold the investment for longer and then hopefully sell it to another company
Hmm.
or go public.
Right.
But it's a bigger investment, right?
Yeah, VCs, that like part of that $1 million was venture capitalist funds. They can be investing at that stage for sure.
Okay.
Probably smaller than $1 million is too little
Okay.
for a venture capitalist that wants to deploy a lot of capital. And certainly not every venture capitalist is interested in that early stage. There's some that, you know, they will only write checks for $20 million plus, which is, you know, crazy to
Okay.
me. It's funny because I have this conversation every once in a while where I talk to someone and they're like, oh, you know, you're raising less than the $20 million that I want to invest in people. And I'm like, you can give me 20 million. I don't have a problem with
That's
that.
right. Yes. And then the final stage of raising capital, which can happen before or after you go to the markets, would
Hmm.
be private equity. But private equity's model either is something like Warren Buffett, who will buy your company
Right.
because they love the idea, they love the management, and they just have more access to capital to help you grow.
Right.
And they're going to leave you alone. You're going to be in this portfolio for the next 30 years.
Exactly.
Or
And
it
if
could
you
be
think about it, right,
a KKR, or another company that just aggregating businesses, and at some point they're going to spin them off back into the market or sell them to another company.
right. So
Yes.
the way that it's important to think about it, less than like angel versus venture capital versus private equity, is that when you are investing in small companies that are very early stage, you're taking a lot of small bets and hoping that one kills it in the next 10 years. When you're making a later stage bet, you're saying, okay, I'm going to invest, I don't know, 100 million into a company that I know will make me 200 million in the next 2 years, right? So there's basically like a lower risk, lower reward for those larger amounts of money. And typically you have a lot more proof points to actually come up with when you want private equity investment versus an angel or venture capital investment, right? If you are very early, it's just like, hey, I have this great idea. Let's see if we can figure this out. Whereas if you're later, you need, you know, much more track record and financial management, and the size of your company needs to be at a different rate for it to be profitable, right? And the return is also lower because you've already went through the risk.
Great. And what do you do for philanthropy? What do you have, a charity? Do you have a group of people you mentor?
I do. So I spend a lot of my time with other entrepreneurs.
Okay.
That's something that I care a lot about. And obviously through my background, both in healthcare and outside, spend a lot of time telling, you know, helping them out. They also help me out, right? It's very much
Yes.
vice versa thing. In terms of other uh, philanthropic investments, I do actually work with this organization called the Greenhouse Project here in New York. That
Okay.
is uh, a elementary and middle school greenhouse for public schools, so people can learn science through actually doing the work,
Okay.
which is a really cool thing, and something that I'm a big fan of.
And then I always ask, because I could talk to you for a couple hours more, but I will, because I have a couple of people I want you to meet, and I some ask of you. But who do you admire in the medtech industry? Who do you think is really out there changing the world of medtech right
Yeah.
now? Great innovator.
So there's a couple people that I find really admirable. I think one of them is actually my old boss. So Aaron Bali. He's the CEO. He was the CEO of Udemy, the company that I was a part of.
Okay.
And now he's the CEO of Carbon Health, which has already become one of the biggest kind of expansions they've done amazing in actually expanding in primary care and building like a tech forward, One Medical 2.0 type of company.
Okay.
Love what they're doing, and the guy is, a pillar of integrity in my mind.
Okay.
The other guy that I find really interesting is the CEO of Alidate. And the reason for that is because they're actually doing a lot of great work to help independent practices take advantage of value-based care work, something that I think is really, really valuable. And it doesn't apply as much to pediatrics because the feedback loops are much longer, but
Yes.
I love their focus in independent practice in the same way that, it's an inspiration for what we do, also focus on independent practice.
So do you think pediatric independent practices can survive the tsunami of the Amazons and the Googles and the CVS?
Well, I mean, I think it takes people to actually fight for it. And it's one of the things that I've, really respected about working with independent practices is that they're very passionate about what they do and they want to fight for it. And we are doing the same, right? I think it's going to take a lot of effort to turn the tide, but I think it's worth it. And I think it's worth bringing in technology. I think it's worth doing all these interesting things so that we can actually give the tools to the independent pediatricians that they need to actually turn the tide.
Great.
But it's not going to be easy. It's going to get bloody out there.
I always say with technology, you can't just let technology loose in medicine.
Right.
You need a doctor or a human step in between, because if you just let technology go, what do we have, Pedro? Rise of the machines, right?
The rise of the machines.
And so, are you reading any particular book that you want to share with the audience today?
Yeah. So I would actually recommend. It's a book that I read a long time ago, but it's called The Hard Thing About Hard Things by Ben Horowitz. He's a very famous entrepreneur. But the key to this book is actually around his own experiences in making really difficult decisions at the scale that a venture-backed, like massive corporation has, right? Because it's different, right? It's different from, like there's a lot of loneliness to that path. There's a lot of really difficult decisions you have to make. And it's helped me kind of understand what leadership at a high scale is, especially for those who are looking to be entrepreneurs and who want to build that. I would highly recommend that book.
Okay, that's a great recommendation. Well, George keeps telling me I'm running long on time, which happens a lot with me. I really have enjoyed this conversation. I think you have a phenomenal concept, a phenomenal team. Really appreciate that you're trying to keep practices independent because it is extremely near and dear to my heart. But also, without independent physicians, we will not have a competitive marketplace, which will hurt the customer, and the customer is 350 million Americans. So we must fight hard and together in order to innovate and bring people like you into the conversation, as well as smart doctors and other thought leaders to move forward. And I think it is a fascinating episode on behalf of the Institute for Pediatric Innovation and the Lounge, and George, Mick, and I really appreciate your time with us today. And I hope we have you back and do some deeper dives into data and execution.
Awesome. Would love that.
Okay.
And it'd be great if EHRs would work with you more. I think
you should tell him. You should tell him.
I think if the back and forth flow, it would be brilliant.
Yep.
It takes time, but it's doable.
We're on it. We're on it.
That takes time.
Awesome. Thank you so much for having me. This has been a pleasure. I really appreciate it. And Really appreciate the conversation as well.
Well, thank you.
Thank you.
All right. We'll see you soon.